All right, next section of the ebook. This is the taboo of the healing drugs. This is a bit of a controversial topic, so I'm going to kind of go through it a little slowly and explain it. If you have any questions, of course, you can leave feedback or leave questions below in the comments section. So, the taboo of healing drugs. First, I already kind of did a video on this, but I would like to do an actual video that goes along with the part of the ebook that talks about this. But before I even start talking about this, I want to just make it clear that I am not condoning illegal activity here. And I actually just did a paper in my English class on a little bit of this concept on whether or not hallucinogens can actually help heal addictions and other psychological ailments. And what I found through my study and research from other papers and studies that I use in my topic is that, yeah, they do, more or less. Hallucinogens have the ability to help you deal with those hidden memories and problems that you've had hidden in your subconscious memory or even in your conscious memory. It helps you confront them. It helps you through kind of symbolic means to interact with them, deal with them, understand them, and resolve the issue. And that's what the point of this whole system is about. The only reason I even talk about using hallucinogens is because when somebody is involved in an addiction, when you're shooting up all day, when you're waiting for your drug dealer that's taking hours, you're sitting in a parking lot for 3, 4, 5 hours sometimes, depending on your dealer, just waiting for your shot. You're sitting there, you're sick, you're going through withdrawals. This type of lifestyle, some people can handle it pretty well. I think I did a good job. I was able to make it to work every day. There were a few days where I was like 2-3 days in withdrawals and I had to call in sick because I literally couldn't get out of bed. But most of the time, people have a hard time dealing with having a full productive lifestyle while being an addict. And the reasons for that, I believe, are more because drugs are illegal. Thus, it makes the whole situation, it makes the whole environment of the country difficult to be a drug addict, and you begin, your addiction becomes your full-time job. And so that's why I'm a proponent of legalization, full legalization of all drugs. Not because I want everybody to get strung out. In fact, I want everybody to get cleaned up and to realize who they really are, get into themselves, really figure out, make amends with those problems that they have, rewrite those old scripts that have been embedded into their subconscious memory since childhood, and be a better person. The reason why I want all drugs to be legalized is because it relieves a lot of the problems that, a lot of those obstacles that keep somebody from advancing and from becoming a better person while being an addict. And many of these things that I talk about here, the main point of my program is to use meditation for self-healing. Well, it would be a lot easier for somebody to use meditation for self-healing if they weren't spending their whole day out there looking for drugs or trying to score or waiting for their dealer or, being sick and not being able to get a job. If they could just go to the clinic, pick up, their daily supply of heroin, pure heroin that's, measured by pharmaceutical companies, that's put out there. They're not worrying about changing purities. You're not going to worry about overdoses. You're not going to worry about having to call the 911 when your friend overdoses and worry about getting in trouble in that sense. It really opens up an addict to having a more healing experience, as being an addict. So, okay, the taboo of healing drugs. So there are several drugs out there that have been studied as being beneficial psychologically and for addiction. There's ibogaine, there's LSD, there's MDMA, there is psilocybin, there is DMT. All of these drugs have been studied thoroughly. Rick Strassman did a study on ketamine, which actually showed significant results. So we have these drugs that have been shown in studies that have beautiful results as far as addiction goes, yet they're, most of them, illegal in the United States. So you're going to have a hard time getting a hold of them. I mean, maybe not, and you might be able to get them pretty quickly. But the problem with that is that I can't recommend these treatments. But I'm going to tell you how these treatments work, and how, if you're in a country where they're legal, you could use these treatments to cleanse yourself. First point here is that all drugs have a purpose, okay? Even illegal drugs have a purpose, and hallucinogens have a great purpose. They're of most interest to us because they allow you to have access to your subconscious mind. It would be better to be able to do this through meditation. But like I said before, meditation takes time. It takes, sometimes years to get to the point where you can effectively communicate with your subconscious mind and deal with these issues and bring them to a resolve. So, the taboo of the healing drugs. Ibogaine seems to have the highest effect on addiction, not only because of its hallucinogenic properties, but because it also calms, especially for heroin, it calms withdrawals. Even though some people experience mild withdrawals after taking ibogaine, most of the time people go into an ibogaine clinic into full withdrawals, ingest the ibogaine, and it takes care of their withdrawals because, obviously it has some mechanism in it that relieves the withdrawals. So that's why it's been of such interest in the field of addiction recovery. But anyway, let me go over really quick how to use a hallucinogen, even though I don't recommend doing it. If you can do it the meditation way, do it the meditation way. What you're going to want to do, again, I'm not recommending this, I'm protecting myself. You're going to want to get the substance, understand the substance, read up on it, understand how the hallucinations work, and you're going to want to get a babysitter. It would probably also be a good idea to get somebody who's medically trained, who can watch over you, who can monitor your breathing, your heart rate, your blood pressure, that kind of a thing. And when you ingest the drug, you're going to want to plan ahead of time. Read up on the drug, and you're going to want to give yourself a month, 2 months, thinking about the experience, anticipating the experience, anticipating what is going to happen with the experience. Do this every day. This will instill in your mind that come the time of the experience, your mind is already pre-programmed that is what it's going to do with this drug. That, okay, this drug is going to happen, and we're not going to focus on giggles. We're not going to focus on, tripping out and having a good time. We're going to focus on bringing issues to the forefront in a very healing fashion, not in a bold, in-your-face fashion, in a very healing fashion, where you're going to be able to relate with the experiences that you've had. You're going to be able to understand the steps that led up to your addiction. You're going to be able to absorb it all in a very healthy, healing manner, and you're going to be able to resolve these issues and let them go. This is the main mechanism behind using hallucinogens as a medication, as a means of alleviating the symptom of addiction. So, like I said, you're going to want to plan ahead. You're going to want to get somebody in on it that is medically trained. You're going to want to get a babysitter, somebody who is a close friend, possibly, that can talk. If you start to have some anxieties or trip out a little bit on on what you're experiencing. You're going to want somebody there who can comfort you. You're going to want the place clean. You're going to want a good, clean setting. I'm sure going up in the woods, going camping with some close buddies would also be acceptable. So as you approach this day, just anticipate it. Understand that it's going to be a healing day. On the day, you're going to want things to go smoothly. If things start off rocky, if something bad happens that morning or whatever, you're not going to want to do it. You're going to want to be in a good, healthy state of mind when you do this. As you ingest the drug, just remember that it's cool. You're going to be okay. It's fine. You're going to probably encounter some things that might be a little upsetting. Just understand that the point of those things happening is for you to heal. So don't let it upset you. Accept it. Communicate with it. Understand it. Let it heal you. Let it show you how to heal yourself from these problems. Don't continue using hallucinogens as a means for the healing mechanism. A lot of shamans will do this, and with shamanism it's different. They're trained in the art of the hallucinogen and the art of the spirit of what they're experiencing, and more power to them. Like, they can do their thing. But for people who are just trying to alleviate their addiction, trying to get rid of the symptom of addiction from being in this poisonous world, don't rely on this all the time. Go through a couple of these sessions, make sure you do each one, make sure it's a good setting, make sure you're in a comfortable, good mind space when you do it, and let it work on you. Just let it do its thing on you. Don't try to push it too hard. Just let the drug work and let it show you the things. Each time you do it, anticipate. Once you feel like you're in a place healthy enough to where your drug use is starting to go down, you're maybe only getting high every now and then. Once you're at a place where you can have a job and work with your life, stop with the hallucinogens. Okay, there are side effects from hallucinogens. There are there's prolonged hallucinations. There are flashbacks. There are elements to using these drugs too much that can, in the long run, have a damaging effect on you. That's why I recommend you just do it long enough to where you feel like you can handle it on your own, and get a schedule going, get a job, and start doing meditation on a regular basis. So that is that section. Again, go ahead and read the section in the ebook titled "The Taboo of the Healing Drugs." It's too bad that it's a good thing that we're starting to investigate it a little bit more. There's a lot more studies coming out day after day. Rick Strassman has done a beautiful study on ketamine. I highly recommend, if you can get a hold of that paper, check it out. Ketamine does some amazing things, and it has the fewest amount of side effects. In fact, let me grab this. Okay, I've only got about a minute left before I hit 15 minutes, but let me grab this chart. I'll just show it to you. Maybe I'll just end up editing it and throwing it up there. This is after your first treatment. This is a group that Strassman did after the first treatment of addiction. First, second, and third treatment. These are the treatments of ketamine. The tendency and desire for addiction went down quite a bit. This is the beginning tendency, the orange one. So this is tendency before and after each treatment. After that, each consecutive month, it continued to go down to where we hit the 12th month, and it's almost completely nullified. So that's that. Enjoy the rest of the videos, and I'll see you guys in the next video. Thanks. Bye.